Managing pain in labour. You may not know how birth will feel until the day. If you experience any pain, there are many different techniques you can use to help manage this. Breathing techniques. Effective breathing techniques maximise oxygen for you and your baby, slows your pulse rate, and lowers your blood pressure. Learning to focus the breath in labour reduces stress hormones and anxiety. It also relaxes the muscles around your womb and reduces pain. Ask your midwife where you can learn these techniques. Entonox, gas and air. Entonox is inhaled or breathed in through a mouthpiece. It's a combination of oxygen and nitrous oxide. It won't remove all pain, but it can reduce the pain sensation. It takes about 15 to 20 seconds to work from when you start to inhale it. You are completely in control of how much Entonox you use. Once you stop breathing it, it wears off quickly. This is available in all birth settings. Side effects of Entonox. We do not know of any side effects for your baby. Pethidine, diamorphine, and meptazanol. These drugs are given as an injection, usually into your thigh. They may not remove the pain, but they can make you feel more relaxed. It takes about 20 minutes to work and lasts between 2 and 4 hours. Side effects of pethidine, diamorphine, and meptazanol. These medications can make you feel sick, lightheaded, and forgetful. Given too close to birth, it can affect your baby's breathing. If this happens, your baby can be given another drug to reverse the effects. Your baby may be more sleepy after birth, which can interfere with the baby's first feed. Pethidine and diamorphine are available in most hospital settings. Meptazanol is not available at all hospitals. Check with your midwife. Epidural. Epidural is a type of local anaesthetic which numbs the nerves that send pain signals to your brain. It can only be given by an anaesthetist, and therefore you cannot have an epidural at home or in a midwife-led birth centre. The epidural is a package of care. This is what you can expect. You will sit in a curled position while the anaesthetist numbs the area to introduce the needle into your back. A very thin tube is then introduced through the needle, and this is what will be left in place to give you the local anaesthetic. An epidural can lower your blood pressure, so you will need an intravenous drip running with extra fluids. Continuous monitoring of your baby will be recommended. Most people need a catheter, a tube into your bladder to drain the urine, as you lose the sensation of needing to pee. An epidural is a skilled procedure and can take 10 minutes to set up, or much longer. It will take a further 15 to 20 minutes for the effects to be felt. An epidural can provide very good pain relief, but it's not always completely effective in labour. Side effects of an epidural. The contractions may slow, therefore you may need another drug to speed them up. You may have an increased chance of an assisted birth with forceps or a ventouse, as the epidural makes it harder to know how to move your baby down. You will need to wait until the epidural has worn off before standing up. Water birth. You can use a birth pool for comfort during labour and get out of the pool to birth your baby, or you might want to use the pool for both labour and birth. Being in water helps you change positions easily, as the buoyancy of the water will take some of your body weight. Warm water relaxes muscles and helps the perineum to stretch, which can reduce tearing. It also produces endorphins, your body's natural painkillers. Your baby is already in water and will find the birth into a pool a very gentle transition into life. If you are birthing at home, you can hire a birth pool. Most midwifery-led units offer pools, and some consultant-led units also offer water birth. Your labour and birth may change. Being aware of all of the options that are available will allow you to make informed decisions. It's okay to change your mind about something during your labour. If this happens, you can always discuss this with your midwife. To find out more, visit sneewellbeing.org.uk/maternity.